Vexed, Vehement. I'm not going to ask you which category you're in. Are you Vaxed or Vexed or Vehement? Maybe like me, you're in all three categories. Dr. Peter Landless will do a closing plenary in a few minutes. And then we'll have a response. We'll have a response from one of our local physicians, so I'm going to introduce in a few minutes as well. Dr. Landless, as you know, is the Director of Health Ministries at the General Conference. But what you did not know, he is Executive Director, the Commission for the Prevention of Alcoholism and Drug Addiction. And that's where the connection, I think, happens with Andrews University. We have a Center for the Prevention of Drug and Alcohol Addiction. And Peter has done tremendous work with our faculty, like Dwayne McBride, Kurt Vanderwall, Elena Baltazar. And that maybe is the Andrews connection, where we do tremendous work together to advance not just healthy living, but living in a way that makes us less dependent on chemical dependencies. So please put your hand together and let's welcome Peter. He's going to present for us virtually this afternoon. So please help me welcome Dr. Peter Lang.
Thank you very much. I hope you can see my screen. Can you see it? Do you see my screen?
We can see you.
Can you see the slides?
Not yet.
Oh, brother.
Now we can.
Thank you very much for the welcome, and thank you for the privilege of being with you this afternoon. And I hope I don't vex you talking about vaxxers and anti-vaxxers and the vehemence that some of us have faced and many of us have encountered over the past 2 years. We're living in an interesting time, and I've really been blessed and appreciate the privilege of being part of this important meeting again. My apologies for not being with you, but I have to express gratitude for the vaccines and also for Paxlovid and also testing opportunities, which precluded my to remember each day, and what really gets me out of bed in the morning, and that is that life is a precious gift given to us by a loving and graceful God. And we've been created in his image. We've been given this life as a privilege, as an opportunity so that we can serve. We do, and we have many options and opportunities to prepare the health that he's given us. But we need to remember that amongst those and undergirding it all, he sustains us. Not only does he sustain life, but he heals our diseases. And it's always humbling and gracious for me to remember that without him, nothing was made that has been made. And that's partly why we have such a tremendous service of gratitude to him because he has given us all. The Seventh-day Adventist Church has, since its inception, and in fact prior to even getting its name in 1863, has had interest in health and health issues. Lifestyle principles are foundational to our Seventh-day Adventist health message, and it is germane to who we are as a church. And despite our brokenness, we experience and understand that optimal lifestyle practices foster positive health outcomes. And this is so important to remember that it occurs within the framework of, as I mentioned, our brokenness. We bring nothing perfect to the Lord, but through his faithfulness, he gives us wholeness despite ourselves. And this reminds me again that we are fearfully and wonderfully made, including the amazing immune system, which has been the focus of so much conversation over the past 2 years, the desire and need to get vaccines produced at breakneck speed, and records were broken as that happened. But it's good to stand back and to think, if there's the amazing tool of a vaccine, what an amazing system the immune system is. So these optimal health and lifestyle practices that we talk about, that we try to live, that we share, also function in keeping the immune system optimal and at its best. But in the process of looking at Adventist health ministry and whatever aspect of it we're in, be it education, be it in the healing ministry, be it in teaching, the Bible remains foundational. We have 3 foundational cornerstones, as it were. The one is the Bible. And as we look through the Bible from Genesis through to the end of Revelation, we see that health is a theme running through it. The health of those in the Garden of Eden, they were given work to do, they were given healthy food, they were treated as fully dimensional beings, not only their well-being, their physical well-being, their mental well-being, their spiritual well-being, as God met with them in the garden and talked to them each evening. And we saw the rules that God gave in public health to those as he led them through the wilderness, giving instructions on how to deal with human waste, caring about clean foods. And then we see, as Jesus came into the scene on this earth, we see that he increased in wisdom and knowledge and stature and in favor with God and man. All dimensions, the spiritual, the physical, the mental, the relational components. And then, as I mentioned earlier, the church has been blessed with the Spirit of Prophecy councils, which long before science proved any of the commentaries that Ellen White made on health to be true, she was given the what, but not the how, of living healthfully. Today we are blessed to have the third cornerstone, and that is peer-reviewed, evidence-based health science. So we use all 3. It's not a 2-legged stool, it's a 3-legged one that stands on all of the 3 legs: the Bible, the Spirit of Prophecy councils, and peer-reviewed, evidence-based health science. These are all important to remember as we continue with our conversation today. And in those principles of health ministry, it's important to remember commentaries, because it sometimes is wrenched out of proportion to say, well, the Bible and science are in total disagreement. Well, Ellen White gives this counsel, which I find so helpful. Rightly understood, science and the written word agree, and each sheds light on the other. Together, they lead us to God by teaching us something of the wise and beneficent laws through which he works. And there are those who would like to throw the science out, who would like not to take it into account. But that is not how the Adventist health message has been put together over the years since the inception of our fledgling church. During the pandemic, because of the emphasis that's come on the importance of understanding vaccines, immunization, and prevention, there are those who have accused the church of no longer caring about lifestyle as being important in helping us to stay healthy. We could never be further from the truth than that. When people say that the church no longer espouses lifestyle as important, you can take it from me that that is not the case. As you know, we're right in the heart of creation health, and the many programs that are present and initiatives from Florida and around the world showing how we can take the natural remedies, the additional components of adequate choices, integrity, relationships, and all of these work together in assisting us to maintain a healthy lifestyle. And then each of the lifestyle habits, daily exercise, which hopefully we do, drinking plenty of pure fresh water, getting into the sunshine for careful and regular exposure, resting, something which perhaps my own pulpit is a little shaky on, but getting the adequate 7 to 8 hours each night, fresh air, balance, temperance, not only avoiding alcohol and tobacco, but avoiding all things harmful and using all things healthful wisely, balanced nutrition, careful nutrition, thought through nutrition. And then not only lifestyle habits, but life habits of making positive and informed choices, of understanding what our choices are about, in having the background, and then having an optimistic, hopeful outlook. Sometimes I'm reminded, and I try not to look in the mirror too much, and those of you who know me well will understand why that's the case. But I'm reminded when I speak to the saints that of the little girl who turned to her father, who was a farmer, and said, "Daddy, I think that donkey over there is a very good Christian." And the father said, "Why would you say that?" He said, "Well, just look at his long face." We need to be hopeful. We need to be optimistic. We need to have a cheerful outlook, and then integrity. At a time like this, when there is so much false information being spread, disinformation, integrity is so crucial in each of our endeavors and our initiatives. And of course, those positive, supportive relationships, which have been under such challenge with the physical distancing, and I wish we called it physical distancing, but it's been termed social distancing, and we understand why. But so many people have struggled over this last 2 years, and we see the tremendous tsunami of mental health consequences, which are coming not only to young people, but particularly to young people, but in all age groups. Trust in God. This is foundational. We are a faith-based group. Our health work is to extend the healing ministry of Jesus. And so it's foundational for us to trust in God. And all of these lifestyle habits and life habits, it's not either or when it comes to prevention of disease, when it comes to considering immunization. It's both and. And some would have us to think that it would be best for us just to focus on the healthy living. Well, I have stuff to share with you which may just highlight the importance of having the balance. Of course, each of us is responsible to know our own health, know your numbers, your weight, your blood pressure, blood sugar, cholesterol, and not only to know them, but to act on them, to follow through with the regular health checkups, at least annually. and then not to ignore symptoms. And when it comes to public health measures, wash hands often, avoid contact with those who have known infections, wear your masks appropriately, stay home when symptomatic, clean and disinfect regularly, touch surfaces. And then, of course, responsible, informed immunization all play a role in having well-being and health during and even when there's not a pandemic. With all this going on, what does the church say about vaccines? Well, in 2015, and without prescience, but understanding that perhaps one of the Achilles heels of our health message was the fact that we didn't have a statement regarding immunization, the church voted the 2015 immunization statement, which in summary encourages responsible immunization. And at the same time, we have as a church no religious or faith-based reason not to encourage our adherents to responsibly participate in protective and preventive immunization programs. Part of the impetus to getting the statement out was the rumbling that I sensed of the years of working in health ministries and also being in clinical practice and teaching situations of those who would like to have a religious reason for Seventh-day Adventists not to take the vaccine. So what is responsible immunization? Thought through, studied, evidence-based, and where the benefits outweigh the risks. And this is what our church has practiced for years when sending out missionaries, when facing the issues of smallpox, typhoid, and other diseases has followed. That statement also says we are not the conscience of the individual church member and recognize individual choices. These are exercised by the individual. The choice not to be immunized is not and should not be seen as the dogma nor the doctrine of the Seventh-day Adventist Church. And statements available on the website for you to peruse at your convenience. Well, the question then came up, well, what does the church say about COVID-19 vaccines? Well, the vaccine against COVID-19 remains a vaccine. And understanding that this was raising questions and issues in people's minds, in December 2020, in collaboration with General Conference Biblical Research Institute, Loma Linda University Schools of Pharmacy and Public Health, General Conference Health Ministries Department drew up an informational on COVID-19 vaccines, addressing concerns and offering counsel. Again, highlighting the point that the church is in favor of responsible immunization and it remains the choice of the individual. Subsequent to that, and as many of you are aware, there were highly publicized conversations taking place where the church was accused of ignoring the religious liberty components of the pandemic, and disinformation was continued to be shared regarding COVID-19 vaccines. The church reaffirmed the Seventh-day Adventist response to COVID-19, which includes responsible immunization and careful understanding that we are facing a public health crisis. And this is key and foundational to what we are talking about today. The church views the current pandemic as a public health crisis. You may say, well, what do you think it is? Well, there are those who would wrench it out of proportion and say, well, no, this is just a whole farce which has been engineered to regulate population control to be able to tag people, trace people, interfere with privacy, etc. The church nevertheless views the pandemic as a public health crisis. We do have the proclivity at times to shoehorn significant events into our eschatological thinking, and this situation was no different. The global upheaval caused by the pandemic generated considerable speculations regarding end-time events. And a view that was propagated was that the vaccines were produced to introduce a process of control that would lead to the application of the mark of the beast. This is contrary to Adventist philosophy and understanding of the Bible, and particularly the interpretation that the end-time controversy centers on the law of God, and particularly the fourth commandment. For this reason, it should be made clear that Seventh-day Adventists understand the mark of the beast to be not a literal mark, but a sign of allegiance that identifies the bearer as loyal to the power represented by the beast. And that's why it's important to remind ourselves that this is a public health crisis with which we are dealing right now. Excuse me just a sec. There's another distinct perspective which some raised, arguing that the vaccines make those who take them unclean, because supposedly unclean substances are used to produce them. Looking at the abiding biblical instructions forbidding the consumption of unclean food and blood, these principles do not apply to vaccines for the obvious reason that vaccines are produced as medication to save lives, not to serve as food. Can there be side effects to the vaccines? Of course there have been. And the side effects have been mostly in minor degree, and there have been a very small number of deaths directly linked with the vaccine. The benefits of being vaccinated far outweigh the risks of vaccination. As you can see for yourselves, just go to the Johns Hopkins map. 6.3 million perished, over 513 million cases, more than 11.3 billion doses of vaccine administered. And yet, there are many who would have us feel that this remains an experimental vaccine. And of course, we've witnessed that deaths and severe illness cases have dropped dramatically in countries where vaccine rollout has already widely occurred. And so in conclusion of where the church stands on the COVID-19 vaccine, it's in line with the immunization statement, which says that it is the individual choice. The church is not against immunization and encourages responsible immunization, with each individual making their decision in consultation with their healthcare provider, their own research, and their own conscience. So as we witness the global magnitude of the pandemic, the deaths, the disabilities, and the long-term COVID-19 effects, we are encouraging our members to consider responsible immunization. Note, we're not mandating it. And the hope is that we will get to that herd immunity, and ultimately this will become an endemic issue which can be coped with on a much more meaningful basis. And this just summarizes the thoughts that it is an individual choice. The church encourages immunization, including with COVID-19 vaccines. Will we all agree on the way forward? Well, I think within the room that we're in now, we are pretty well agreed as to where we're headed and what we're doing. Yes, there are real fears and questions. We do need to listen to each other. And it sometimes is difficult to even hear each other when insults, hyperbolic hubris, and other ways of addressing and speaking are in tone at the time. We do always need to be respectful of one another, and nor should we vilify nor stigmatize one another. And all of these things have taken place over the last 2 years, and particularly over the last year, where letters and phone calls and conversations and bully pulpits have been employed in trying to do just those things of vilifying, stigmatizing, and sharing much disinformation. But I'd like to share with you just briefly, and we're at the end of a day, a busy day, and there is still some to come. I'd like to share with you that the church has walked this road before. This is not a new issue. In fact, Willie White recalls as a child being perfectly healthy until he was vaccinated, and then his health was much impaired. His mother listened to the arguments regarding the methods of vaccination, that they'd been improved. So at a later time, when associates asked should they be vaccinated, she, Ellen White, offered no objection. And as you probably will remember, Ellen White herself was vaccinated against smallpox. D.E. Robinson reminds us of this, that she herself was vaccinated and urged her helpers, those connected with her, to be vaccinated. She recognized the fact that it has been proven that vaccination either renders one immune or greatly lightens the effects of the disease. She also recognized the danger of exposing others when they failed to take the precaution. And there are those in the flock who say, well, Ellen White was against immunizations. We don't see that, according to these reports. When you look at the forerunners of our Liberty magazine, we're in 1896, and she was still alive at the time, and where the questions were raised, should one be compelled as an unwilling citizen to be vaccinated? The argument that was brought, well, because if he remains unvaccinated, he would be liable to catch the smallpox, but more importantly, he may die, but solely, and this was the account they took into consideration, but solely because his unvaccinated condition renders him specially liable to become a source of contagion to others. And so the editors went on to contrast this rare instance of allowable state force. Remember, there are many who are saying this is a religious liberty issue, compared to what was most importantly for him, Sabbath Sunday keeping. And so we see already in 1896, the end of the 19th century, this conversation was taking place. In 1918, 1919, influenza virus responses in the Advent Review and Sabbath Herald, and I would like to attribute these, the source of these comments. They were given to me by Nick Miller, who has researched this, and I am very grateful for his sharing these. It was written in the Advent Review and Sabbath Herald in 1919, vaccines have an important use. They do much to diminish the more important complications. And then added into that, again, what we've tried to do over the years to bring a blend of the both and healthful living and appropriate preventive measures. And then talking about the qualifications of a missionary in 1937. He must not expect God to work a miracle in caring for him when he neglects the means that God has given him for his protection. And the commentary was he must be vaccinated, this particular missionary, for smallpox, typhoid, and many other ailments. So the church has a track record. This is not new, that we are supportive of immunization and vaccines. And so it goes on, and there are these excellent reports which harp back to the fact that there is really nothing new under the sun. And what goes around comes around. And the agencies of vaccines and antitoxins in this particular piece was referred to as agencies that have practically cleared the world of once tragic plagues such as smallpox, typhoid, typhus, and bubonic plague. You may be interested to go to healthministries.com, and you'll find a very scholarly piece written by Jerry Muscala looking at the theological perspectives on principles related to immunization. Obviously, immunization is not mentioned in the Bible, but it would, in certain terms, refer to what this statement from Proverbs says, well be taken as biblical advice or authority for the whole modern program of immunization. And the conversation continues over the years. There was a resistance of an individual who didn't want to give their daughter diphtheria inoculations. And I really was interested in the wording. There are certain facts that must be faced. Shall I, as a parent, give my child diphtheria inoculations? Or shall I take on my broad but ignorant shoulders the responsibility for the possibility of this tragic death months later? And so we see this recurring theme coming throughout the history of our church, where we've encouraged missionaries, where we've actually mandated vaccines for those going out in service of the church to difficult areas. And so, as was mentioned in the introduction today, vexed, vaxed, vehement. We've walked an interesting road, a road that has been scattered with difficulty, dogged with death, and we've had separation, difficulties. We understand that community immunity is vital if we are to see an end to this pandemic. And we as a church have a duty to work on ensuring that something like that takes place. Could it be that responsible immunization includes our responsibility to protect one another and not only ourselves? And my prayer is that the Lord will guide us as we make our choices to his honor and glory. So, after over 2 years of pandemic, polemic, serious losses, separation and isolation, so many have suffered. How do we feel? Well, that question is asked of me often, and I will tell you, I have hope. I never dreamed that the church that I love and serve be divided the way it has been over the issue of vaccinations. But I do believe he will see us through. Why? Because he's proved himself faithful. The church is the apple of his eye and the object of his supreme regard. And I know, as you do, that the handkerchief of Revelation will wipe away the tears of Genesis, and we should not grow weary in doing well, as each of you continues to do well, serving and working as faithfully as you do. Yes, I have hope, and I pray that you will be in good health and prosper in all things, just as your soul prospers. And wish you shalom in the sozo dispensation if you will. May God bless you.
Thank you. Thank you, Dr. Landless. So that was sort of the global view of our church. And for the next few minutes, we thought we'd have a response from one of our practitioners, Dr. Shu, a board-certified internal medicine, board-certified infectious disease, right here at Advent Health. So Dr. Shu, give us a response to what you just heard.
Thank you. Good afternoon, everyone, and thanks for letting me fill in. We weren't sure what was going to happen with Dr. Landless's talk, but I'm so glad that he was able to share. And yes, I mean, there are clearly so much in healthcare that complements what Dr. Landless had said. We, Advent Health, we are here to extend the healing ministry of Christ. The issues that were brought forth earlier are exactly how we approach it on a community level. But I do want to just talk a little bit about how we approach things on the healthcare level as well. COVID vaccination has been an area of great debate among healthcare professionals, and healthcare professionals, for those of us, for those of you who are in taking care of patients, we swore not that we would not do any harm. And transmitting a preventable infectious disease is something that we want to take great care not to. And so there has been a little bit more discussion in healthcare settings about issues related to mandatory vaccination. This was something that was thought long and hard about. And while, of course, at the very beginning, the focus is making sure that those who want to get it first, get it first. Those that are in the community that are most immunocompromised get that. That was absolutely going to be the first priority, and we worked on ensuring that we prioritize it for that. But at some point later down the line, when we started getting April, May, June of 2020, then you started saying, well, now we've got more vaccine than we have people who are willing to take them. What do we do with that? And so with that part, I just wanted to provide some commentary on that. I did have slides, but because of time purposes, we'll just go ahead and forego that. One thing is that, again, to recognize that we in healthcare have a higher standard. And so for Advent Health, that meant really encouraging vaccines. We encourage vaccines because the data are there that it saves lives. And from a public health perspective, that's what we want to do. We also recognize that, in the healthcare lane, it was a lot narrower. So, for example, issues related to masks and other issues were clearly something that we wanted to follow. The CDC had direct actionable items that we in healthcare had to follow with respect to that. The other thing, though, that healthcare that we had to do when we thought about things were, we need to make sure that we followed the law. And as you know, we live in a union of 50 states, each with their own different approaches. And I had colleagues at Loma Linda that I would talk to, and we had a law that was passed in late in 2021 that stated, you shall not mandate vaccination. You had to make sure that everyone could be exempted. It was pretty clear about that. And I was talking to my colleagues at Loma Linda, and they were saying it was exactly the opposite here. The California Department of Health says you shall get your vaccinations and also your boosters, for that matter. So, so we really had to make sure that we did what we could to encourage vaccines, but make sure that we followed the law. And as things changed, and as there was a new federal administration that took place in 2021, 2021. Then there were issues about CMS, OSHA standards, and again, Advent Health said, we want to do what's right, and we want to follow the law. We also spent a lot of time discussing alternatives. Should we talk about if you don't want to make if you don't want to mandate vaccines, maybe we can opt for testing on a regular basis. making sure that those who weren't vaccinated, or maybe making sure that those that are unvaccinated needs to wear an N95 mask, because we recognize the benefits of well-fitted masks in reducing transmission. These are all things that were thought about. But probably one of the big issues that we had to struggle with, and again, these are issues of competing values, were, we had a very, very short workforce. We had a lot of folks that, would have said, if you have to make me get vaccinated, I would rather not work for Advent Health and go somewhere else. And there were plenty of other healthcare settings that would say, we're happy to take you. So with all those things being done, eventually Advent Health, and with the CMS regulations, we have a strategy now where we do follow the CMS mandates. Clearly, exemptions are provided, and of course, our employees who do not wish to get vaccinated can certainly do so. They have an easier time through the religious exemption pathway than they do through a medical exemption pathway, but it's certainly possible. And right now, I think the fear has died down. We are in an era now where, with Omicron and with the variants and the subvariants, the effectiveness of vaccines isn't to the degree that we saw with Delta. And so as a result, the fear over vaccines have died down, but we still have plenty of clinicians and healthcare workers in which we want to continue to provide the message that vaccines are safe, they're effective, they work. I mean, there is a lot of pushback. About a couple of months ago, I gave a keynote address to a group of physicians. I was invited to speak there. It was in a very rural part of Florida. Very rural. And I was warned. I said, you're going to be speaking to a lot of doctors there who don't necessarily follow the science. And I said, I'll be good. I will not talk about controversial things. I'm not even going to mention ivermectin. I won't talk about masks or vaccines. I just wanted to focus on where we're going in the future. And I thought the presentation went really well, and we talked about burnout and the need to preserve our workforce, and how mindfulness is so important, for us to stay well. And at the very end of that discussion, a general surgeon at the very back went up and gave about a 5 to 10 minute tirade on why masks don't work, on why mindfulness is just useless. He's, what about my salary? What about my car that breaks down and I can't get parts because there's disruption in the, you had a litany of things to talk about, and then he ended his tirade to rapturous applause from the group. And I thought, oh my gosh, this is really the end. I probably should never accept a speaking engagement to doctors in rural Florida, but we want to continue to keep moving forward. And so as a clinician, I know Dr. Landless talked about the 3 V's, right? Vaxed, Vexed, and Vehement. I'm going to offer my counterpart, which is the 3 C's. And that is, as clinicians, I have moved. At the very beginning of the pandemic, I just couldn't understand why there was so much controversy over this. Clearly it is what it is. But I have learned over the last couple of years that the 3 C's, that what we need to do as clinicians with our patients is really to exhibit, number one, compassion, to really understand where they're coming from. There are some people who are still on the fence. There are some people who just really, are not exactly sure where they want to go yet. And I say no now does not mean no forever. People change their minds. And unfortunately, we've seen people change their minds in the hospital when it's too late, when they come down with COVID and don't recover from that. We also need to reevaluate how we communicate. And communication means so many things. But I think the better part of communication for me is really to listen. Just to spend that time understanding what it is that vexes them. What is it that really, affects, understanding why they make the decisions that they do. And for us, communication needs to be both ways as well, of course. The last C is commitment. And when we're talking about commitment, it is really to make sure that we don't waver. The science is there, it's clear. We want to continue to make sure that the science about vaccines is clear. And if it changes, it changes. I mean, if it's not effective for the next variant, it's, we need to make sure that we communicate that. But we need to commit to telling our patients about what the science are. I do not, and I never advocate for dismissing patients who don't agree with me. And there are times when I do feel that way, but I have made it very clear. I mean, if I dismiss a patient because they don't necessarily believe what I do about vaccines, guess who are they going to go to? They're going to go to a doctor, and there's plenty of them who say, we don't have to worry about vaccines. There will be no pressure for them. And we want to make sure that we continue that. So compassion, communication, commitment. I'll end right here because I know that it's been a long day for all of you. I just wanted to discuss a little bit about the future. And Dr. Landless expressed that very clearly. I'm optimistic as well. I do recognize that we are in an era now where things are looking much better than they, of course, have been in last year and January. Are there going to be other waves? Of course. I mean, we have to be prepared for another wave. And you've heard of BA.2. There's in South Africa. There's now reports of BA.4, BA.5, and we have to keep an eye on that. But we must continue to learn from the pandemic. I hope the worst is over, but the issues of vaccines may continue to rise, especially again as we understand that. So clearly, the things that we've learned in the last hour or so, we need to continue to keep in the back of our heads because there could be another wave. But I am very optimistic that we are getting toward a period of endemicity. I will end with a quote from Jeremiah 29:11. Of course, all of you have heard this. It's probably way overused in all the things. At every graduation I have, we always talk about Jeremiah 29:11, but I think it's really appropriate for the pandemic, and that is God has plans for us, plans for a future, for hope, and to keep us safe. So with that, I want to thank you very much for your time. I'll turn it back over.
Thank you very much. Maybe a few questions from our participants today. We do have 10 minutes. Thoughts, questions? For Peter, for Vincent? Or not?
I think we'll have questions that maybe takes us a moment, or maybe you're just really tired. But the question I think that all of us have faced is how to measure the sincerity, I guess you could call it, of the religious exemptions, because we've had mandated vaccines at our place for a long time, and then somehow in the context of COVID, a lot of people discovered a religious conviction they didn't have before. And were quite earnest about it, and you weren't quite sure whether they were getting it from news media or from some new revelation from the Spirit, because we didn't see that before. So how to assess that and how stringent to be about it. I gather from what you said, Dr. Shu, you were fairly generous with those.
Yes, as it comes to dealing with religious exemptions, the federal government actually has very clear guidelines on how you should process that. And of course, the intent was to provide those with bona fide religious exemptions a way to be able to practice their beliefs without fear of discrimination and so forth. I think, as Dr. Winslow, as you had said, yes, I mean, people were able to use that same approach as it related to religious related to religious exemptions. So yes, are they being widely utilized? Yes, I'm sure they are everywhere. Is there something that we can do otherwise? I don't think there is. I mean, having a CMS mandate in place in healthcare, at least, has done a really significant job of getting our vaccination rates to a really reasonable number. And so this is probably not an area at this point that we want to go to at this point. And we've had plenty of discussions with our legal folks about that. So it is what it is. It's better than where we were. I think that we should just take that as a victory.
So thank you for an engaging presentation, both. You say we have the science. What do we do with the apparent erosion in trust for the CDC or government, because this topic has been politicized? How do you respond to that? The growing skepticism.
I'll take a stab at that. Of course, Dr. Landless, of course, is welcome to provide that. Yes, I mean, this is an era that I have never seen before in my life, with this politicization and the lack of trust that we're seeing in our public health authorities. The CDC recognizes that. I think the first thing that CDC has to do, I mean, having worked there, is to acknowledge some of the areas that they have perhaps areas that they could improve. And I think they're working on getting that communicated. I mean, the first thing to developing trust is to recognize that in areas in which perhaps there have been movement that perhaps was not ideal, that they should probably make sure that they're transparent with the public. There have been some concerns about some of the data that have been published that were kind of one-sided. Not everything was being published. So we do need to be as transparent as possible. But I think the other thing is that it was very difficult for them, because you are asked to make decisions at the last. I mean, they want answers as of yesterday, and you don't want to be wrong and have to change things on a dime. And I think that put them in a very tough position, because you want to have answers quickly, but sometimes the data just aren't out there. And I think, again, good communication about how that should be done, I think, would be very helpful. And I think, and I think it's really, I mean, restoring that trust is going to be challenging. I think all of us in healthcare have that, but I think, as mentioned, we still need to continue to stick to what we understand the science to be. It's not perfect. For every 5 papers that may say something is good on one direction, there's a paper that has the opposite. So you want to be able to take the entire thing. So transparency, understanding the whole picture, I think, are things, and again, continuing to communicate with our patients in a way that's really compassionate. Good communication is critically important.
Thank you. Peter?
Yeah, I fully concur, and I think Dr. Shu has summed it up very well. I think that the area that I'm empathetic with the CDC and others who have been putting out the protocols and so on is this is a moving target. It's on the move the whole time. Things are developing. Yes, trust is going to have to be reestablished, but I think Dr. Shu covered in general all the issues that it's going to take to make this, to make everything right. And time is going to be the healing process. And I really deeply want to affirm and appreciate the 3 C's, especially the compassion. Because as we compassionately, respectfully listen to one another, we will be able to communicate better with each other. And I think things will turn out to be better. But there's a way to go.
Yes.
Speaking as a pastor, thank you. Speaking as a pastor and having the wonderful privilege of pastoring in a medical community, a church filled with good, precious people, has underlined for me just how incredibly divisive this has been, where even in a medical community we have people who once sat in our pews, who will not be back, who have gone not just other Adventists, but other churches, specifically because they were faithful to God and didn't follow mask mandates and not meeting for a period of time, etc., which was a bit stunning to me in our community. At the same time, we've had people who say, we're not coming back because you're not taking this seriously enough and we don't feel safe there. And others who say, we won't be back until these mask mandates disappear. And it is just underlined for me the true reality of a no-win situation. And the return to worship has been slow. It has increased, but it has been slow over time. Barna Marketing Group says that pastors can expect 30 to 50% of their members to come back, meaning 50 to 70% will not come back.
Wow.
So it has been a profoundly divisive time, certainly in communities and healthcare settings, but seeing it up front, up close and personal, in a medical community in the church has been a bit destabilizing and surprising.